Hi, everyone. Welcome to Project Echo Care of Older Adults and the KCH session. My name is Pam Yankee-Love, and I'm the Director of Research at the Traeger Institute. And welcome. So glad you're here. I think so many of you guys may have been with us at the Optimal Aging Conference, and we're so glad that we're beginning the week and ending the week with wonderful things about lifestyle medicine. So today we're going to be talking about lifestyle medicine, and on May 19th, we're going to be talking about aging with HIV in the Southern U.S. June 16th, we're going to be telling you a little bit later what that particular session is about. So thank you so much for joining our Project Echo. It is a joint connection between KCHC and University of Louisville Traeger Institute. For those of you guys who haven't been able to be part of us, you or haven't been on Zoom in a while, you can go on and check your microphone, and you can go on and turn on your video. That helps us get to know one another in our learning community. There's a way to go on and check it, your video and your microphone and audio capacity. So just go on and use the little caret in the lower left-hand portion of your video screen. And if you were to get disconnected from the Zoom, you can always call in using the information that's on your agenda that you should have in your calendar invite. So for those of you guys who haven't been a part of Project Echo, we thought we'd begin by first telling you KCHC's mission. And I think that Mona Huff will be jumping on and sharing the mission of KCHC.
Yes, certainly. Thank you so much. The Kentucky Coalition for Healthy Communities is a coalition that creates community support systems for older adults and partnerships with the existing local organizations and coalitions. One of our main tasks is to develop the workforce and concerned community members to empower our communities to become healthier. We really do believe that health is possible, including biological, mental, emotional, and spiritual. And we invite you to talk and help us make the KCHC what it should be. Thanks so much.
Thank you, Mona. And for those of you guys who haven't been at a Project Echo was developed by Sanjay Arora, a MD from the University of New Mexico. He's a hepatitis C expert, and he was basically having patients drive 200 and 300 miles to come and see him in his practice, and he didn't feel like he was increasing local capacity. So he developed a Project Echo, and the idea is not to move patients, but it is to move knowledge and to build capacity at a local level. So he developed this telementoring platform called Project Echo, and Project Echoes are now all over the world. There are many Project Echoes on many topics, and there's typically a rhythm to a Project Echo. It has a didactic, and it has a presentation of a case. And then we provide recommendations as an interdisciplinary team. So it's a teach all, learn all platform. So we hope that we can all engage in that space. If you haven't done so yet, we do ask that you go on and type your name and your organization in the chat box. So go on and put your name and your organization. This also helps everyone in the learning community get a sense of who's in and where does everybody come from and what's their different roles. We do also ask that you go on and put your name in your little Hollywood video square. If you have yet to do that, you can go on and click on the 3 different little buttons in the upper right-hand corner of your little video square, and you can click on that, and there's a name, and you can type your name in there or someone else's. All right. You can also receive an attendance certificate for the hours of today's session. And you would go on and complete the short survey. We ask that everyone go on and complete the short survey. It will be presenting as a poll at the end of the session. And we will ask that everyone go on and do it. And there'll be a question in there that asks if you would like a certificate for attendance. Today, we have a Dr. Samantha Cotton, and Dr. Samantha Cotton will be discussing lifestyle medicine approaches to improving cognitive functioning. And let's go on and do a little bio for those individuals who don't know Dr. Samantha Cotton. So Dr. Cotton is an assistant professor in the Department of Geriatric and Family Medicine. Dr. Cotton earned her PhD from the Kent School of Social Work and Family Science in 2018. Her research interests include older adults living with multiple chronic diseases, the needs of needs of individuals with Alzheimer's disease and their caregivers, including developing innovative, evidence-based practices for caregiving in the community and in nursing homes, and infusing compassion and caregiving in both community and long-term care settings. Additionally, she has significant experience in working on compassionate and age-friendly initiatives in nursing homes through her PhD dissertation and through her GACA, which is, she is also a geriatric academic career award recipient, a board certified social worker in lifestyle medicine. She has co-written numerous HRSA grants and articles and is the project's lead on the Alzheimer's disease and related dementia aspect of our Traeger Institute's Geriatric Workforce Enhancement Grant. We're fortunate to have her at the Traeger Institute, and we all call her a colleague and friend. So thank you so much, Dr. Cotton. It's been a long week, and we appreciate you doing this with us.
Wow, thank you for that wonderful introduction. That was lovely, Dr. Pam. Thank you so much. I did put my headphones in, so I hope you all can hear me okay. I just realized thunder is happening tomorrow, so they are practicing very loudly near where I'm based out of today. So I'm glad I quickly was able to pivot to using these. So we'll have time for questions at the end of our session. But as Dr. Pam indicated, we're going to be talking about lifestyle medicine approaches to improving cognitive functioning. And I really call this a reframe to talking about brain health and cognitive health. I say that because, one, I think in society, we've really gotten, oh, you can go to the next slide. Thank you, Pam. In society, we've really gotten a lot of, I don't even want to call it misinformation, but we've gotten a lot of focus, whether it be intentional or not, on brain health and cognitive health. And so there's a lot of information out there. It can be sometimes difficult to kind of synthesize through all of that and figure out, okay, what is it that I need to do to take care of myself? So that's going to be our primary focus today. And, you know, I think at different junctures in our life, we do become, you know, concerned about cognitive health. As we get older, we might start noticing some of these natural declines in our cognition. And I always like to take a step back and really differentiate between what are those things that are just those normal signs of aging, those normal signs of us sometimes being stressed and not being mindful, and what's truly something for us to be concerned about, right? And not all of those changes that we see that as we're moving through life, maybe too quickly and not being mindful, or as we get older, are really that concerning, right? Sometimes, you know, we might lose our keys. I always make the joke of, I'm forever losing my keys. That's just like my one thing. I never know where they're at. I'm always misplacing those. And so it's not until we sometimes get older that we start worrying about this. And I think what that largely tells us is that sometimes we get wrapped up in what society tells us about aging and about memory and cognitive decline. You can go to the next slide. And I think largely that discourse around cognition and cognitive health and brain health, and I'm going to use cognitive health and brain health kind of interchangeably today because they're essentially the same thing. But there's a lot right now focused on what we call the wellness movement. And that wellness movement really tells us from that brain health perspective, we need to buy this supplement, or we need to have this fancy, cool water bottle to stay hydrated. We need to play this particular app on our phone, or this particular brain game in order for us to stay cognitively intact or cognitively healthy. And that largely, I think, can be confusing for us. It makes us think we have to buy something or do this one thing and it's going to solve all of our problems related to brain health. So I want to debunk that today and say that, yes, I love that we're having this critical moment in history where we are focusing on wellness, but I think it can be a bit misguided and a bit confusing for people in general. If you can go to the next slide, please. So, you know, there's a lot of information out there. A couple of nights ago when I was preparing for this talk today, I just went to Google and said, tell me more about, you know, cognitive health. Tell me more about brain health. And the amount of articles that I found that were so all over the place about this particular topic were interesting. And I've pulled a few here. And the reason I wanted to highlight these in particular is, the fact that if you're keeping up with, what's out there in the news cycle about brain health and about those things you're supposed to be doing to optimally age, you're going to probably be all over the place in terms of the work that you're doing to focus on yourself. And I'm not saying even that these things that are listed here, like, Tai Chi or walking or, listening to music or playing music for that matter are bad things. I think the limitations in some of this information that's out there is that it makes it very singular focused. And it makes us think that there's this one magic thing that we can do, so that we're really focusing on that brain health piece. You can go to the next slide. Excuse me. And I say all this to also say that there are some risks to our cognitive health, and that there's one, I'm going to get to this, but there's not one magic, thing that we can do of all those things I pulled up from that Google page. But things like smoking, nutrition, that American diet that's predominantly focused on high fat foods, junk foods, fast food, the level of stress that we just feel, I think these days, that has collectively been heightened by the pandemic, by COVID. And not to say we didn't have any stress before the pandemic, but in general, I think those are some issues that have been exacerbated by the pandemic. The fact that we tend to, as a society, be in this mode of that 24/7, like, let's always be working, let's always be doing something. There's always something for us to consume on television, so we're not getting quality sleep. Again, another thing that has been largely exacerbated by the pandemic, which would be social isolation, that feeling of not being able to connect with your family and your friends, and just our general lack of physical exercise that we do on a daily basis. And again, I'm talking overarching about our society and some of the things that we really do. And I would say that a lot of these things, all of these things that have in common, are that they are these health behaviors that we engage with, sort of societal or cultural at this juncture. And I think those are all really things we need to be focusing on. And lifestyle medicine as a field has really been focused on these areas as well. So go to the next page, please. So when we talk about lifestyle medicine, I want to be very clear about what we're talking about, especially if if you're on today and you've not attended one of our previous sessions about lifestyle medicine. It's really this focus on using whole food, plant-based dietary lifestyle changes, looking at that regular or integrating that regular physical activity into your daily routine. I can't stress the importance of movement as part of this enough. Restorative sleep, stress management, avoidance of risky substances, and really positive social connection through health, those healthy relationships with other individuals, and really treating that as this whole health approach to the way we take care of ourselves. Can you go to the next slide? And I say that to really build up the fact that because of the way we tend to talk about brain health, because of the way we really focus in on some of these challenges to brain health, like, for example, Alzheimer's disease and mild cognitive impairment, all of these conditions that I think has the discourse around it has really created this fear around memory care as a whole. And I think it's time for us to reframe that and take it back to the basics. And I want to highlight, I'm going to say this over and over again today, there's not one magic pill for cognitive health, for brain health. It's really these things that we do for our overall health that are critical for cognitive health. So when we start talking about these lifestyle medicine approaches, it's really, I really want to stress that the things that you are doing to take care of yourself, to help you optimally age, all of those areas that we're going to talk about today are pretty critical for cognitive health. The other thing I want to stress is keep it simple. I think, again, a lot of times when we start talking about these various interventions we can do from a wellness perspective, again, society really tells us, oh, you need to buy that particular water bottle. you need to, go on that trip to get rid of your stress. And again, it's really about keeping it simple and focusing on the basics. And when you're making big changes, and I want to stress something here as well. Some of you who are on today, you might be on because you're a professional working in the field. And so you came to learn more about some of these different interventions related to lifestyle medicine and cognitive health that you can use with your patients or clients that you're working with. Some of you might be on today because you're looking to make those changes. Maybe you're worried about your overall brain health. Regardless of that situation, if you're making big changes, it's so critical that you start slow with those changes. Make them sustainable for you, make them feasible for you. So when we're talking about some of these areas today, I really want you to understand that that's one of the most critical pieces. And again, I'm going to keep preaching this. There's no magic pill for cognitive health, despite what, wonderful Google search that you've stumbled across that tells you you need this particular supplement, for example. So today we're going to focus on these interventions that are, from a lifestyle medicine perspective, looking at those pillars of care that we can implement for our own cognitive health. Again, this doesn't just take care of your brain health. This is an overarching process by which you can make these changes to help you be both preventative in terms of your overall health, even if you're not dealing with some chronic condition or you're not dealing with some particular issue at hand at the moment. I really want to stress that some of these things that you're going to be doing can be that really strong preventative approach to making sure that your brain is staying healthy as you get older. But also, if you're already having some challenges in this area and you're struggling, looking at these different areas and really implementing these interventions can be helpful as well. Next slide, please. And I also like to stress from the perspective of lifestyle medicine, I think sometimes we get into this idea of, oh, it's too late for me, right? I can't make these changes. Or some people might say, I'm too young. I don't need to start focusing in on this yet. Regardless of how old you are, it's never really too early or too late to start implementing some of these healthy behaviors. I promise you, making these, even if you're doing this from a very structured change approach, making these small changes can really be helpful. So we're going to start with nutrition, which is actually one of my favorite topics. Everybody loves to eat, right? So when we talk about nutrition from a lifestyle medicine standpoint, we're talking about, really focusing in on those whole plant-based foods that are fiber-rich, nutrient-dense, health-promoting, and disease-fighting. Now, you might be saying, okay, where's meat in all of this, right? And I want to highlight a couple of things. One, you might not be in a place where you are ready to make a change to go to completely a plant-based diet. And what I want to encourage you is that that's okay. From this perspective, we want to meet you where you're at in terms of, your motivation to change in that moment. So if you're a professional on this call today and you're working with clients who are not necessarily in a place where they're motivated to make some of these changes, you're really going to have to work with them on some of these areas. That's why I always say, start with small changes, create a sustainable plan for yourself, for your family, whoever is part of your family structure, so that you're really committing to those changes. Sometimes it can be just helpful to make those small swaps. For example, if we're looking at, maybe you like to make pasta, it's an easy, quick meal. Switching from traditional pasta to maybe a lentil or chickpea-based pasta with your meal is an easy fix that you're probably not going to notice right off the bat, right? But you're getting additional fiber, you're getting additional nutrients that can be helpful for you. I often also really try to avoid, there's a lot out there about brain health and all of these different, what I call fad diets, right? And I like to not focus on the word diet, one, because I think it really has this connotation of being more weight focused versus really that sustainable nutrition piece of the puzzle that we know that's so important for brain health. And a little caveat, though, I would say that in some situations, we might find ourselves maybe working with a client, or maybe it's ourselves. Maybe that fad diet we started, right? And it kickstarts this journey for us where we start thinking more about the food that we're eating and we're making healthier choices. And I say go for it if that's the case, right? But again, it's really important to pivot from some of those bad things because they're very restrictive in terms of what you're eating, and very sometimes mono focused on eating certain types of foods or having certain types of nutrition. And so really doing that piece can be so important. I think also one more thing I want to say about nutrition is food is medicine, right? So we want to make sure that from a brain health perspective, we really are focusing on this nutrition piece because nutrition, food is what fuels our body. And so it helps us think clearly. And so, again, that's also why I try to avoid those fads when possible, because a lot of those are, again, very, very restrictive in terms of what they're pushing out there to you. Next slide. Sleep. So think about, when you don't get a good night's sleep, how that impacts you, how you, from an emotional standpoint, you might be a little bit more prone to crying or, feeling all the feels about a certain thing that maybe is not a big deal in your life. You might feel foggy or groggy when you don't get quality sleep. So things that we tend to suggest from a brain health perspective is making sure you're getting that what we call restorative sleep, that really quality sleep. Creating a schedule and sticking to it. Remembering that we can't bank hours, right? So let's say on Thursday night, you only got 4 hours of sleep and you think, oh, well, I'll make up for that on Saturday. I'll take a real long nap on Saturday afternoon. That's not the way sleep works. So we really want to aim for most people 7 to 8 hours a night of that quality sleep. Also, in today's modern society, we are always on our phones, always on our computers, always on our TV, watching TV, doing something with what we call blue light. All of these different devices that we use emit this blue light. And that can be so problematic for our quality sleep. And sometimes we don't even realize it. I recently read a study that was done last year about any type of light right before bed, especially light from your phones and other devices, can disrupt our sleep in a way that we don't even understand. But we notice it because long term, we're feeling groggy. We're not thinking clearly. We might not, emotionally feel like we want to. So again, the importance of sleep, I think, is critical in terms of our brain health, and focusing in on some of these areas can be so important. Next slide. Exercise. Now, from a lifestyle medicine perspective, we really want to focus on that regular and consistent physical activity. It's so important to stick to a schedule. We want to aim for 30 minutes a day, but I will tell you, a lot of research has gone into this to show that if you're going from 0 to anything, that's an improvement, and that's what we want to see. So even if you can only do 10 minutes, maybe you're just starting out and you've not built up your stamina or your strength to be able to move for 30 minutes consecutively at a time, that's okay. Do not get discouraged. It is so important to set those small steps in terms of that physical exercise piece and just get moving. Maybe you're a person who gets bored with a certain type of activity, figuring out, maybe I do Tai Chi one day, or I do yoga one day, I walk another day. Maybe you need to break it up throughout your day. So you're doing 10 minutes here, 10 minutes there, 10 minutes later in the evening after you eat dinner. Whatever it looks like for you, I think it's so critical. And I think that a lot of the evidence has shown us that if you're going to make one change in your day-to-day routine, exercise. And we know that currently the structure of our American society, we don't get enough movement in our day. And another thing that I often recommend as well is if you feel stressed about trying to exercise by yourself, you can really knock out 2 of these areas we're going to be talking about today, between that social connection piece and that exercise piece, by having an exercise buddy, having a friend that you can share this with, this journey that you're on, and also get moving together. So you're really having that healthy bond together but you're, getting moving. You can go to the next slide. Stress management. Oh, every time I go to any type of tabling event, whether it be the state fair or just different health fairs that we've been part of at the Traeger Institute over the last year, everyone always looks at the lifestyle medicine flyer and says their eyes immediately go to stress. How do I decrease my stress? So we obviously know one that all of us have positive and negative stress responses and coping mechanisms that we sometimes deal with in our day-to-day, right? I just want to highlight that even sometimes positive things can cause us stress because it's a change to our, routine. And sometimes even with positive things, like for example, starting a new job can be stressful because there's unknowns with that process, right? So even if it's a positive thing, sometimes we need to think about that stress and figure out ways to manage it. You want to find those things every day that you can do that are healthy coping mechanisms to really help you focus on, what brings you joy. What is that, thing that you can do for, even if it's 5 minutes during the day, to help you step away from the stressful situation that you're in. And creating that routine of self-care is so important. I want to go back to something I said earlier, which is in our society, we've largely predicated this idea of self-care to reduce our stress as it's been commercialized, I guess, for a lack of a better word. And so we have, all of this marketing towards us, whether it be on social media or TV commercials, take the trip, the only time that we can engage in self-care to better manage our stress. And that's such bogus. With stress management, that really are things that we need to do every day. And figure out, what are those things that we can do in terms of taking care of ourselves. Next slide, please. And then healthy relationships, really building that social connection to others, which again, I know has been so difficult during the pandemic. Because of having to isolate at home and all the ins and outs of that. So really focusing in on how do we get back to that. We know that social isolation can be so damaging for brain health. The way social isolation works is we don't have that emotional connection to someone else. We're not able to share how we're feeling or how our day's going. And all of those things can be problematic for our overall brain health and for cognitive decline. So really focusing in on some things that we can do in terms of that piece to really focus and move forward with our overall care with our what I would call our social health. You can go to the next slide. And then last but not least, avoiding risky substances. There are some well documented dangers of any addictive thing and it can also increase our risk for things like cancers, heart disease, cognitive decline. So we're talking about things like smoking, excessive drinking, taking medications that are not prescribed to us. All of these things have again, well-documented impacts on our overall brain health. So from a lifestyle medicine perspective, we really want to focus in on avoiding those risky substances at all possible. Next slide. So I know this was a brief presentation, but I wanted to conclude today by saying I threw a lot of thoughts at you about potential interventions for cognitive health and how you can really focus in on these different areas from a whole health approach to really focusing in on that cognitive health piece, that brain health piece. So you might be thinking, where do I start? And the same could be true if you're a professional working in the field and you're really trying to work with one of your patients in this area. I always say, create yourself a roadmap. And it doesn't have to be really formal, right? It's really focused on starting with one clear goal. What's that most pressing issue, right? I used myself as an example here. Sleep would be my most pressing issue. right? Not having a routine, not, one day, I might get 9 hours of sleep. The next day, it might be 3 hours of sleep. So knowing that about myself and really taking that step back and saying, I need to prioritize sleep. Starting with that as my goal, right? I can then add other goals from these other areas into my day-to-day routine. But to go back to what I said earlier, that, starting small, even those small changes can have such a great impact on our overall brain health. So if you don't take anything away from today, take that. Doing something and making goals is better than doing nothing. So starting small is really, really important. And I think with that, my next slide is just my information. Do we have any questions?
Thank you so much, Dr. Cotton. Let's see.
I think we have a comment from Amara. Thank you, Amara. Exactly, when talking about self-care and the importance of my social work course, professors have emphasized that self-care doesn't necessarily mean go on a, yes. So it's definitely focusing on those, small activities you can do that bring you joy. That's what self-care is.
I think Debbie Scala may have raised her hand. I can't really see.
Yes, it's Debbie. Hi, Debbie.
Hi, I had a couple questions. One to clarify, what is your definition of quality sleep? I have a Garmin watch now, thanks to my husband. And so it delineates what's REM and what's deep sleep, light sleep. So what are you talking about?
Yes, so we're talking about those ratios related to all of those different areas of sleep. In your Garmin watch and other devices that track this as well, there's usually a ratio that you're looking at from a REM standpoint, how much deep sleep that you get, how much most of your sleep is going to be more of that light to moderate sleep, right? And so focusing in on, again, that total being 7 to 8 hours of total sleep. And also, let's not disregard, so sometimes, all these trackers, they're wonderful. I use one actually myself, but how do you feel when you wake up? Think about that. That's really the focus of what I'm talking about. Do you feel groggy? Do you feel tired? By 2 p.m. in the afternoon, are you needing that, caffeine to get through the day? Sometimes it's important. Yeah, all these metrics are wonderful, but from a very basic standpoint, intuitively, what I'm asking you to do is take a step back and saying, how do you feel?
Yeah, okay, that's good. The other thing that I've heard on TV, there's this advertisement that is advertising hearing aids or hearing services, and they say dementia is the main factor. If you're having hearing loss, it's a predictor of dementia. I feel like, I don't know if that's true. I haven't ever heard you say that, or in all of this with Traeger. And so I'm thinking, of course, there's no little byline of what she's referencing. But anyway, what do you say about that?
There have been studies that correlate hearing loss with as a predictor for things like dementia, right? Now, I go back to this whole health standpoint. If you are struggling in an area like, hearing, being able to follow a conversation around you, of course, that's going to make you more confused, right? Because you're not able to connect socially with others. So it goes back to my philosophy of take that whole health approach. If you're having an issue in this area, let's address it, right? So, I don't think that's going to solve all of your problems, right? If you're having issues in some of these other areas related to memory, related to following communication, that's just probably going to be one piece of the puzzle. But that particular ad is probably referencing some of those studies that have been done in the last 5 years or so that have focused on hearing and why it's so important for you to look into that and get further assessed if you're struggling in that area, because it can be a predictor for cognitive health later on.
All righty. Thank you so much. I think, Dr. Cotton, we're going to have to stop there and go on to the case. Thank you so much for questions. And if you have additional questions, I'm sure if you want to add them to the chat, Dr. Cotton will be able to respond to them. Also wanted to remind everyone that we also had Justin Dials in previous, I think it was last month, who talked about exercise in a deep level. So if you want to have access to that, we can pull that archive out and share that. And I wanted to let you all know that I'm going to be at My Health Matters talking about hearing. So if you want to, I'm sure I'll be sharing some information about the impact of impairment in hearing. So come to that. It's May 8th. Love to have you. So we're going to move on now to our case presentation. I think Dr. Cotton's going to also be willing to take recommendations for this particular case. We have we have another VIP from Traeger here to be presenting the case. We have Dina Wilson. Dina Wilson also graduated from the Kent School of Social Work and Family Science with her Master's of Social Work, and also has an LCSW and is the Assistant Director of Behavioral here at Traeger. So we're lucky to have you today too, presenting this case. So whenever you are ready.
All right, can everybody hear me? Just make sure I'm connected appropriately. So this person is someone that was referred to me. She sees providers in our clinic, and she was referred to me for therapy. And she's a really good, I think, overarching representation of a lot of what Dr. Cotton talked about. And I also wanted to say that Amara is here with us, who is one of our wonderful Flourish Care Navigators, a social work intern that has done some chronic care management with this patient too. So I wanted to invite you, Amara, to chime in if you have anything else to contribute to anything that I'm saying. So just kind of a brief overview. This patient is a 75-year-old white cisgender divorced female. She's currently living independently in her own apartment. She has a really interesting history. She lived in Florida for about 10 or 15 years prior to that, and she had an RV when she retired, and she was traveling all around, living this really kind of interesting, dynamic lifestyle. And she started to notice some changes in some of her family members, and her companions started to notice some changes in her and some concerns. And she started to notice some changes and concerns in her memory and her cognitive functioning. And so at that time, she started down this path of not only figuring out what was going on with her, but also being really proactive in how to approach it, how to manage it, how to slow the progression and all those things. And I'll get a little bit more into that as we progress. But kind of questions to consider, and this is kind of me knowing her and thinking about what we talk about and what's important to her. She is very engaged and energetic and willing to try almost anything, which is wonderful. But I think she sometimes struggles with because as Dr. Cotton referenced, there's so much out there. I think she really struggles to kind of prioritize what to focus on. She wants to be holistic, but she also realizes that she's trying to do everything all at once, and that can also be overwhelming. And then she's also thinking about planning for, dementia and cognitive decline is really kind of is not really predictable. And so kind of not knowing exactly how that's going to progress for her, she's wanting to know how to plan ahead for when things change for her, how to continue to take advantage of some of the things that she wants to do as her functioning and abilities change. Okay, so here's just a list of her primary diagnoses that are in our chart. There's an Alzheimer's disease dementia diagnosis. She did have, when she first started noticing these changes, she had a full workup done, I believe, at Mayo Clinic. And they also discovered an artifact of a prior stroke. And so part of her changes cognitively are connected to that stroke. And she struggled a lot to kind of, and I think is also realizing that she doesn't know how much it matters exactly, but trying to figure out what's contributing to what and what those real causes are. She also has a history of COPD, type 2 diabetes, hypothyroidism, hyperlipidemia, osteoporosis, anxiety and depression. And she's had surgery for cataracts, and she also has some reflux. Clinical measures, she's 5'6", 115, which puts her BMI at 18.6. Her blood pressure in her last encounter was 123/70, and that was marked as a sitting blood pressure. LDL 60, HDL 109, and an A1C of 7.4. All right, so this is just some kind of background information about her, and this kind of follows along with our different determinants of health that we focus on. She's currently living independently in her own apartment. When she moved from Florida to Louisville, she was living for a short time with her daughter and her grandson, but they have since moved on, and she's living in her apartment independently. She's still able to drive, but she does not have a vehicle, and she's trying to decide if she wants to buy a vehicle. She's gotten really good at using the public transportation system in Louisville, and she uses TARC and uses Lyft and Uber and things like that when she needs to. And she's still kind of figuring out transportation in terms of anticipating how her abilities might change. She's able still to manage her finances and most of her ADLs and IDLs on her own. She's noticing in terms of her function, she reports noticing some struggles with focus and attention and word finding, that she finds herself kind of getting a little bit scrambled sometimes. And she's also noticing that when she does notice that confusion, that her anxiety kicks in about the confusion. And we've been working a lot of that in therapy about how, when you start to get really anxious and worried, it does nothing but make you kind of more confused and anxious. So she's making those connections, but also noticing that with her cognitive, with her dementia diagnosis, that part of that is connected to that. She is currently taking donepezil for cognition, and she's taking multiple medications, and we'll get to that in a future slide about all the medications that she's taking. But she is taking multiple medications for diabetes and some of her other chronic conditions. She denies any sexual problems. She expresses an awareness of and really a desire for implementing healthy eating habits. She's met with the nutritionist that we have at OAC for some diabetes education, and she's had her type 2 diabetes diagnosis for quite some time, and she's very aware of how she needs to eat and does that for the most part, but she still struggles sometimes with doing what she knows she needs to do. I think we're all guilty of that. Okay, so social. She shared with me that she's got 2 years of post-secondary education after high school. She worked for, I think, 20 plus years running her own business. She had a produce distribution company. And so she did that, and she retired from that in about 2014. And that's when she kind of shifted to this lifestyle in her RV and doing a lot of traveling. And she also has shared with me several times that since her retirement, she's done some kind of part-time caregiving for older adults. And she really, really enjoyed that a lot and would like to figure out ways that she could continue to do that now that she has kind of more time. She does currently drive, as I said, but she has concerns, not now about her safety, but she has concerns about as her condition progresses, if she will be aware when it becomes unsafe for her. So that's kind of something that she talks about a lot, but she is using public transportation, as I said. Financially, she shares with me that she has significant savings and that she's really not concerned long-term about her finances, but she is working with a financial planner to kind of take into consideration as her needs may change to make sure that she's figuring that out and planning for that. Okay, psychological. She's been working with me since December of last year, and mostly she was referred for kind of these mood issues related to this diagnosis of cognitive decline. She's always been very, very independent, and was kind of experiencing some anticipatory grief and some actual grief about not knowing what this is going to mean for her long term, how her life is going to change. And so we've been working through a lot of those things. She also has a history of alcohol use. She has a very strong family history of that, and she describes some problematic drinking in her younger years, but she has been sober for more than 20 years, and she still attends AA and Al-Anon meetings, and that's a source of support for her that she gets a lot from. She said she's raised Methodist, doesn't really connect as much to that anymore, but she has recently, through kind of meditation practices, become engaged with some Buddhist philosophy. And she's really relates to that and shares that gives her a lot of sense of peace and being able to become more present focused. In terms of her background in school, she always really loved school, she said, didn't struggle in school. And I already kind of I think I already mentioned on a previous slide, her experience with working and her retirement and her interest in continuing maybe with some volunteering. Family structure, I mentioned before that both of her parents, she said, were alcoholics and misused alcohol. And she describes her childhood as very, very chaotic. In therapy, we've processed a lot of how she really feels like she's come to peace with that. It doesn't feel like that's a continuing factor on her mood. She's also divorced after 27 years of marriage. She has 2 adult daughters and 4 grandchildren. 1 daughter and 1 grandchild live in Louisville, and she spends a lot of time with them. That's the daughter and grandson that she was living with up until about 3 or 4 months ago. She's been working on planning for long-term housing. She really would like to find a place where she can progress as her needs change. She's still very much capable of living independently and wants to live independently, but she wants to maybe look at a community where, as those needs change, she can progress through what they have to offer. And I think Amara has worked with her some on that. So if you have anything to contribute, Amara, please feel free to chime in.
Yeah, I talked to her today actually, and she told me that I know that she came to case management for housing because she didn't like the apartment she was staying in. There were some issues. And so today she told me that she was planning on moving into a new apartment recently that's not too far away from the community that she's already in. So she has people that she already knows and it's not too far. So she was really happy about that when we talked this morning.
Oh, thanks for that update. Yeah, and I do know that she lives in a walkable area and has friends in that area, and that's been something that's important to her. So that's great. She is a former smoker, but she quit way back in 1983. And I already shared kind of some past problem drinking that she has been in recovery for quite some time. She is very physically active, looking at one of our pillars of health. She walks daily. She walks in her community. That's one of the things that she likes about where she lives, is it's walkable to lots of different things. She also has a gym membership and she goes to the gym. She has come very frequently to our yoga and Tai Chi classes that we offer at Traeger, and she's enjoyed not only the physical benefits of that, but also the camaraderie. There's a group kind of people that consistently come to that she's developed some friendships with. So kind of a combination of that physical exercise pillar of health and also the social connection pillar of health that she's kind of gotten from that. And as I mentioned before, she reports following a mostly healthy diet, and she is pretty has some good literacy in terms of healthy eating habits, but she also sometimes struggles, as we all do, with kind of using food as a coping skill, going to foods that aren't necessarily healthy as a way to kind of make us feel better in the moment. But she has met, I believe, twice with Beth Ackerman, who is the nutritionist at Traeger. And I don't know, Mona, I know that she has discussed attending the Flourishing Together classes, and I don't know if she's done that yet, but that's something that she's definitely interested in doing. And in terms of medication, she doesn't report any trouble with medication adherence. And so our health services kind of determinants of health. She has access to primary care and multiple specialists. She sees specialists for, her diabetes. She sees an endocrinologist. She sees a neurologist for her dementia. She sees multiple specialists, sees a dentist and all of that. She does not currently have any concerns with obtaining medications, financially or logistically. That's not an issue. She sees me for therapy in terms of mental health and also attends various support groups. I mentioned AA and Al-Anon, and she's also been connected to some early diagnosis support groups with the Alzheimer's Association. So she's been attending those also. And she reports that she's mostly satisfied with her overall healthcare. And she also expressed to me that she feels confident that if she has a negative experience with the provider, she feels able to kind of advocate for herself and find other resources, which I think is good. And she sees the dentist regularly. And it sounds like Amara kind of updated on this, that she's moving to a new apartment, but where she was living prior, I know that she wasn't crazy about it, but she felt safe there and didn't report any hazards in the environment. So we can continue to check in on that as she moves into a different apartment. She's able to maintain, self-care and personal hygiene without an issue at all. And she does describe some occasional stressors with her daughter that she was living with and the grandson. And I think we can all imagine sometimes living in an intergenerational household, there's a lot of benefits to that, but it can also kind of be stressful at times, but she says that overall in general that it's mostly positive, supportive relationships in her life. And she's been kind of purposeful about weeding out relationships that are not. So this is kind of her collaboration of care. And she is somebody that, you know, when Dr. Sam was talking about all the different determinants of health, she's aware of all the different pillars of lifestyle medicine. She's very aware and interested and engaged in addressing all of those different factors. I think she kind of always has been that way, but with the dementia diagnosis and really wanting to maintain her independence and her enjoyment of life and her engagement in life for as long as possible, she's really motivated to tap into all of those different areas as much as she can. So she sees a nurse practitioner and geriatricians at OAC for her primary care. She sees me for therapy, and I already mentioned the different relevant specialists she sees for chronic care management, meeting with the nutritionist, doing the Tai Chi and yoga. She also had that great connection with Amara to help her with some case management and connection to resources. She plans to attend the Flourishing Together classes too, and that'll hit multiple levels of or multiple pillars of health, because I know that you guys are pillars of lifestyle medicine, because those are all pretty much covered in the Flourishing Together program as well. And she still maintains some contact with some providers at the Mayo Clinic where she had her initial workup when she started noticing problems. So she does have some kind of telehealth visits, I know, sometimes with Mayo Clinic and their specialists there. She attends support groups for the early diagnosis Alzheimer's support groups, and AA and Al-Anon, as I mentioned before. So she's got a lot of connection to a lot of resources. Now, here's her current medications, and I would hope to meet with her to clarify, because I like to clarify with folks what they're actually taking, but I wasn't able to meet with her. But these were captured from her last kind of the reconciliation of medications with her last visit, which I believe was about 6 weeks ago. And so I'm hoping that they're mostly up to date. So she's taking the Atrovent for her COPD, and she's taking several medications there for her diabetes. I think Invokana is for diabetes, and Trulicity and metformin. She takes the levothyroxine for her thyroid, and statin for her lipidemia. And then she's got some eye drops that she takes. And she's been taking the mirtazapine for mood and for sleep, which is the same thing as Remeron, and the donepezil for her cognitive decline. And then Prolia is an injection for her osteoporosis. So I guess, is that the last slide?
Yes, it is. I believe it is the last slide. We can go back to the front to go on and get, so if I don't make anybody sick, we can go back to your questions. So close your eyes if you're going to get sick. There we go. So Dina, thank you so much for that presentation. It sounds like question 1 and question 2 is where we really want to focus our energies.
Yeah.
And so just how to prioritize the resources and the support to optimize the impact of holistic lifestyle medicine. Clearly, she seems to be doing a lot of things to address all of the pillars of lifestyle medicine. And then you would also like to see if we could figure out maybe a plan for changing abilities. Let me go on and stop sharing so we can be a community.
Yeah, while you're doing that, can I jump in here and say a couple of things? One,
Yeah.
I know this patient from various things that she's engaged with at the Optimal Aging Clinic, and something that strikes me in talking to her and that I think is connected to something I mentioned earlier in the talking about lifestyle medicine interventions and the pillars is that she has a lot of fear surrounding this dementia diagnosis, almost more fear about the situation when you talk to her than you see it manifesting in, the symptoms. Does that make sense? And so I want to go back to something I talked about earlier, which is stress. And I think sometimes when people get this, like that type of diagnosis, that just inherent stress of, okay, what happens next? What can I expect? That fear of not knowing and feeling like you're not in control of that situation. I see that a lot with her. And I often wonder in my interactions with her if that fear and that stress surrounding this is not exacerbating the situation, right?
Yes.
Because again, she's ticking a lot of boxes here in terms of that brain health piece. So, maybe focusing on the stress surrounding this and some of her conceptualizations about fear and dementia that is so prevalent in our society, and taking her back to this hope piece and really focusing in on some of those strengths that we know she has, that can be helpful for her. So that's one piece that I wanted to say. The other thing I would say is that I noticed, in talking with her, I didn't know her A1C or anything like that. So I didn't know that it was, higher, that she had type 2 diabetes when I was speaking to her. But I did ask her a couple of things about nutrition, about food, what she was eating. You mentioned that she had indicated she knows what she's supposed to do, but sometimes she doesn't. I wonder if maybe not using that brain health kind of mentality of as an anchor for, really honing in on some of that nutrition and making those changes and making them sustainable, I think would be helpful for her as well. And those are my two primary recommendations. But I also think that goes to anybody else on this call who might be working with a patient who has that fear about, cognitive decline and what that means, really focusing in on and highlighting some of those strengths, those things that they're already doing that can be helpful. Because again, I think it's exacerbating it for her.
It definitely is. And we spend a lot of time talking about that. And it's not just the fear. And with a lot of folks that I work with in the early diagnosis phase too, there's a lot of fear of the reactions from others. There's a lot of fear that somebody is going to notice that I do something and they're going to think I'm, she used this term, losing my marbles. There's a lot of social fear related to that, and kind of hypervigilance to make sure you're always saying the right thing so that somebody doesn't think, it's getting worse.
And, really focusing on the self-compassion piece as well, being compassionate to yourself. Right.
And that's where the Buddhist philosophy meditation, she is really benefiting a lot from that. She refers to it as dropping anchor in the moment. She drops anchor when she starts to feel overwhelmed and recenters. And that's been really helpful and uses that kind of positive affirmation.
Do her friends know of her diagnosis?
They do. Yes, they do. And she has a couple kind of inner circle friends that she really trusts. And that's been an important part of her kind of finding comfort as things change, because she kind of trusts that they know her well enough to be able to gauge some of those things. And also that if she is struggling to make a decision, that she trusts that they would know what she wanted to make those decisions on her behalf.
That's good. Is there any books or podcasts or anything that would help her with the hope piece, in addition to seeing Dina? Is there any book or podcast or?
I mentioned it, and she was already connected to Kristen Neff's kind of perspective on self-compassion, mindful self-compassion, and she's really responded to that. Our last session, I gave her some specific journal prompts and readings that were related to that. And I think she mentioned that she had first encountered her on a podcast.
Okay. Anybody else have that? Is there anything in the chat?
There's actually I think he has a podcast. I'll have to go back and look. On Twitter, he calls himself the Alzheimer's guy. And he is, I can't remember how old he is, but he talks about his experiences with being diagnosed with dementia and what that has looked like for him. And just, that connection to somebody else, right? That social connection, seeing that. I think he has a podcast. I'll go look and see. I mainly follow him on Twitter and keep up with his blog posts and stuff. But that might be something that's gives her hope as well, because this is a person who's been diagnosed for a while and is, really flourishing with, everything going on.
Sam, did you want to share your comment in the chat? Oh, it says Sam. Maybe it's not Sam. Maybe it's Justin. Justin, are you? I don't. We can't hear you. Oh no, we still can't hear you. Oh, it's your earbuds.
Okay, how about now?
Yes, we can hear you.
Okay, so I made two comments. One was from Dr. D. She could not be here, but she wanted you to know that there was nothing in her medications that she was concerned about. But if you have any questions, please reach out. And then I made a comment that just if she resonates with Buddhism, it can be really difficult to find pastoral support here. But the Buddhist Recovery Sangha might be helpful. It does mirror the 12-step model, but it's a little bit of a different slant on that, and I included that in the chat.
Thank you.
Thank you.
When she answers the question, what matters most to her, because maybe that would help from a standpoint of where you put the resources or the energies.
Yeah, I think what matters most to her is maintaining her independence and really almost a sense of dignity, if that makes sense, for as the disease progresses.
Okay, so
Yeah.
let's talk about that. So how could she maintain her dignity as the disease progresses? Like, does she have a health surrogate? Does she have an advanced care plan? She have a
She has not, and that's something we've talked about. She's not made anything official, but she has identified the people. And I think at one point when she's had some procedures done, her daughter had some, but she does have people that she trusts in that regard, but it needs to be documented in an official capacity.
Mhm. And I wonder if she's, has some kind of visions of what constitutes dignity for her. And, drilling deeper into that and then being able to decide what resources would help her be able to preserve that dignity.
I think too that as far as maintaining that dignity and independence is she's already surrounded herself with supportive people, but make sure that they understand the diagnosis and how it may progress, and have make sure all her best friends are educated in the possibilities and what supports her most, because being able to make mistakes and still feel supported would be key, I think, in continuing to feel that dignity and independence.
I think that's a really good point. Yeah. Has she ever thought about bringing some of her friends into the therapy space to kind of do that, maybe with Sam coming in and you guys co-facilitate a meeting?
Yeah, I mean, I think she's she's definitely open to collaboration in general. So
Yeah, I mean, I think she would be amenable to something like that.
Yeah. Okay. So it sounds like she could also, moving forward, might be interested in any teaching kitchen curriculum that we might have as we progress into that space at Traeger. Was there someone else that had raised their hand? I may have missed that. Okay. We also are starting a dementia clinic at Traeger, just a very soft launch, and she might also want to be a part of that moving forward as where we can develop a dementia care plan.
Yeah, and I think she's very open. She and I have talked about different pieces of that. And Dina, I think you've also talked to her as well. That's why she came to talk to me about it. So yeah, I think she's amenable to, she's open and motivated in many aspects.
Yeah.
yeah, very much so.
She's almost a model for all of us,
Mhm.
and that she is focused so much on the determinants of health. All righty. I mean, on the pillars of lifestyle medicine. All righty. So I think it's 1 o'clock. I think we're going to go on and transition now to our KCHC meeting. And thank you, Dina, for the presentation. Thank you, Sam, for your presentation and the taking the recommendations and sharing that with Dina. And we will be moving on to the KCHC. Let me see if I can go on and share my screen again so that we can have Mona go on and jump in. Okay, so I'm going to progress very rapidly to the slides, hoping it's ill.
Yes, and I again just want to remind you of the purpose of the KCHC: to train and empower stakeholders and community members to provide hope and education for their communities. And that's the word that we've heard. And so let's go on and talk a little bit about that. Okay, so today, as you have listened, we just want to talk a little bit about what we have learned and how we can share it with others. And one of the questions that Sam asked us in the very beginning is, what can I do to take care of myself? And I want to add to that. what can we do to take care of our family and our community? So how can we share what we've learned today? I'm just going to leave it open for a few moments. You can either unmute and speak to that, or you can put it in the chat and Pam will translate for us.
I'm sorry, what was the question again?
What have you learned today, and how can you get this out into the community? How can we help take care of our community with what we've learned today?
I think just starting off small and being mindful that all the things that we're dealing with can be helped if we're willing to get the help. And just like when we talked about cognition earlier, just being well aware that it's never too late to start.
Yes, thank you for reminding us of that statement. It's never too early and it's never too late. And let's remember that. I think starting out with small changes was something I needed to hear today, especially with nutrition changes and meeting people where they are on this journey. Yes, and that's one of the things that we talk about often, is to choose 1 or 2 small goals and work on those and then celebrate them and then do more. Often we want to make an overnight change. And one of my favorite sayings is, we didn't get unhealthy overnight, so we're not going to get healthy overnight. And it does take time to change our habits. Anything else that you'd like to share? How are we going to get what we have learned today out to our communities?
I think that these small changes, I just and so much is nutrition based. One of my kids got a food box from Feeding America, and I saw how much really healthy food and the beans and so on. But I wondered, I wonder if they have lessons of how to use dry beans. And because that's bizarre. It's like, you look, I'm not going to eat that. What is that? So that was just something that I thought of in relation to flourishing together and the recipes and so on. Is Feeding America adding that piece of the puzzle where they help people use what the healthy things that they put in their box?
Yes. And I hope they do. A lot of these organizations do have cookbooks that they add to it, or PDFs of whatever's in there. And so I hope that they do. And that's one of the things we try to do with Flourishing Together, is just give some basic recipes of how to do some things, and then you can add to them according to your taste. Anything else that we can add? As we're being compassionate and as we are taking care of ourselves, not only are we helping ourselves, but we're also being a model for those around us. Now, sometimes we need to do it very quietly. I have a tendency to talk about it too much, and that can turn people away. So be careful how you are modeling, that you're modeling in a very positive way. And then people are going to see the changes in you as you get healthier. And I'm not just talking about weight loss. This lady is really underweight, or close to underweight anyway, but apparently she still needs some help with nutrition. And that's one of the things we as society always look at a person's size of whether they're healthy or not. And that's not always true. So we want to really practice nutrition. We want to practice activity. We want to demonstrate how we take care of our stress. And of course, we want to make sure that we are sleeping well and avoiding putting toxics in our system, such as tobacco and an overuse of alcohol. Okay, let's go on to the next slide, Pam. So in our community conversations, I like to give you an opportunity to share if you have some events going on in your community, or if you've got something that's happening in your community that has your concern. And let's just talk about that and how we might be able to help you. So first of all, does anyone have anything going on in their community they want to share with us? An event that's going to be happening? How about concerns? Are there some concerns in your community that you would just like to be able to vocalize and for us to maybe talk about for a few moments? Okay,
I feel like
hillbilly days in
policing is a
Pikeville
concern in our
right now.
community.
Okay,
I feel like policing is a concern in our community.
yes, yes, policing is a concern. So what can we do as an individual and as a coalition?
As well as
I'm sorry, I didn't hear that.
health and healthcare, benefits, just making sure that everybody is, able to be fed, able to be clothed, clean.
Mhm. And obviously, as an individual, I can't do it all, can I? But if I take my little corner of the world and help those that I can and model that again very quietly, then it's going to grow. And that's what I would challenge all of us to do. And the concerns that we have, let's not be, what's the word I want? Negative as we're sharing those concerns, but let's share them in a compassionate way, and let's figure out how can we be a part of the solution rather than part of the problem. Anything else anyone would like to add here? Do any of you have concerns about the health of your community, about not only our aging, but other age groups?
Hello, can you hear me?
Yes.
Hi, this is Beverly Broadus, and I have concern with the members of our community who lost the pandemic medical care.
Yes.
It's a large number of people, and what are they to do?
Right, right. And, one of the things that I'm really worried about is that there's a good number of them that don't know how to not lose it. I mean, not everybody needs to lose it, but they need to know how to get the help to make sure they can stay on it. That is a big concern. So we need to be vocalizing that to our legislators. And then we also need to be talking to our people and helping them to know how to get a hold of their area agency, because they do have folks there that are expertise, and they will be able to help them know how to check it out and to find out for sure if they are as one of those that will be losing it, or what to do to keep from losing it.
Thank you.
Thank you for sharing that, Beverly. Anyone else? Okay, so let's go to our next slide, Pam. Okay, so I just want to start us thinking about our annual county challenge walk for health and wellness. And this is our 12th year. Can you believe that? Those of you that have been with us from year one, when it started out with, I don't know, maybe 50, 60 people, but it has grown into something really big, and we're wanting to even get it out into the state more. And what you do with this is that you just talk to people and ask them if they want to walk, run, bike, or swim their way to better health. And we will have flyers out, and you will be able to know how you can go online and record that. Or if you are working with folks who do not use technology, how to be able to get that information and send it on to me, and I can put it in. And how we are doing this now is that we are presenting a traveling trophy to each county, and we have them divided up into small, medium, and large. Who gets the most steps. And we have a conversion on our sheet that has been made that you can just put in either how long you did an activity or how far you went, whatever you can give us the information. And we have equations that will convert those into steps. Now, last year for our large counties, it was Jefferson County won, our medium county Shelby won, and our small county Henry County won. So I don't know where everybody is from on this walk, but I've got a big feeling that there's some that are from other counties that you might want to talk to different people in your area, different organizations, the schools, everyone, get us all involved so that we can start walking. The next slide, that's okay, Pam. So somebody put in the chat, I believe it was Stephanie, who has been coming to our My Health Matters on Monday nights, that they even recommended this for our patient that we heard about today. And on Monday nights, what we do is we meet at 6:30 by way of Zoom. We start promptly at 6:30 and we leave promptly at 7:30. And we have either guest speakers or we have an open session sometimes. And it's just a way for us to learn better health, and also for those who may be isolated, it gives them an opportunity. But our professional people have enjoyed it. They say they just love starting their week with this. And we sure would like each and every one of you to become a part of it. You've also heard a little bit about Flourishing Together. And what it is a free 10-week, and this says virtual, but it can be in person or hybrid. And I've changed this, I don't know how many times, but for some reason, I'm not saving it correctly, I guess. But what we do in this class is that we learn easy and practical ways to eat healthier, become more active, and take control of our own health. Exactly what we've talked about today. And we start encouraging people to take small steps. If someone is not walking at all and pretty much inactive, we may suggest that they just stand at the kitchen sink and hold on and walk in place for a while, or stand up while a commercial is on and walk in place, or sway to some music, and gradually increase their activity. We also do the same thing with our nutritional portion of the program. We don't expect people just to make gigantic changes at once, but a little bit at a time. And in fact, I encourage my folks who may be on a lot of a medication, and especially if they are living with diabetes, to work alongside their healthcare provider, because as they become healthier and they change their habits, they may need to decrease some medication. And so we want to make sure that it's done in a way that's really healthy for people. We also have a program, and I'm having a hard time to see which one that is. Oh, is that our Flourish Care program? I've got a black thing over it and don't know how to get it off of it. But this program, is designed to help adults with multiple chronic conditions to improve life satisfaction through our comprehensive care navigation program. And that's what you heard about today. One of our clients who has been working with Dina, and one of our navigators. And as you can see, she has become engaged in many of the programs that we have and is making real changes. Now, you do not have to be a patient of ours to join a lot of these programs, but for that particular program, you more than likely would be referred from one of our people, but not necessarily. We would still look at you if you want to be a part of us. The caregiver program is designed for caregivers of aging adults who are 60 and above. And we know that our caregivers are such a special group of people, and we want to provide them support and resources. If you have an interest in that, you'll be getting these PowerPoints, and you can do this interest survey here. And then we have our virtual friendly visitor program. And these programs are for those who are lonely and isolated, and we certainly want to meet their needs. And if there's anything else that you need to know, you can go on our website and find it very easily. Okay, the next one is talking about our upcoming Flourishing Together program that we're going to be starting August 1st, and it's going through August 1st. Starts June 1st and goes through August 1st, I'm sorry. And it's from 6:30 to 8, and this one is strictly Zoom. And we would just love to have you join. We would love for you to share this information with folks that you know that's wanting to make some health changes, or if they want to be an encourager for those who are wanting to make health changes and just kind of maintain where they are. Some folks that come really could almost teach the class, but they are such good encouragers. Okay, the next slide, please. It's talking about My Health Matters, our schedule for the next week or the next month. And you'll see on May 1st, we have Dr. Amy Kostelik coming from UK, and she's going to be doing an aging simulation and raising awareness about typical age-related decline. On May 8th, Dr. Pam has already mentioned she's going to be doing a presentation on hearing. And on May 15th, I will be joining Shelby Jordan, who is our physical therapist, and we're going to be talking about the importance of movement and nutrition to arthritis. And on May 22nd, I do have a speaker now, and that is our own Barbara Gordon, and she is going to be speaking to Mind Matters, prioritize or practice strategies for mental health. Sorry, I messed that up. Mind Matters, practice strategies for mental wellness. The problem is I'm trying to read my own writing, and that's bad. Okay, next slide, please. So in closing, you've heard me talk about being
Mona,
a
before you-
model. and
Mona,
you've heard
before
me
you close, I just wanted to mention that there were a few people who put some activities or events that are going on in their communities in the chat.
Thank you so much, Barbara. Yes. So we see Out of a Darkness, Prevent Suicide, Sunday, 4/23 at 3 p.m. And baby shower for passport members, May 4th, starting at noon at the Bowling Green One Stop. Thank you very much for bringing that to my attention, because you know it's hard to see all that when you're got the big screen up. And I just want to remind all of you too, if you would like to do flyers for any of these, you can send them to us before, I would say 48 hours to give us time. And we will load them as part of this presentation. So they'll be right there for folks. So anytime you want to share something, please feel free to do that. Okay, so my part of the closing, you've heard me talk about being that model to help others understand health. So our pledge is we will become an effective state coalition working with community members and community-based organizations to empower our state to become a healthier and compassionate people. Therefore, we will practice self-care and model healthy behaviors to our families, co-workers, and members of our communities. And that's our hope for each and every one of us. And this is just a little ditty I put up. Sometimes the smallest step in the right directions ends up being the biggest step of your life.
That's right.
And I think we've talked about that in pretty good detail today. So I'm going to turn it back over to Miss Pam.
All righty, thank you so much. I think what we're going to do now is go on and have a poll. This is my first time that I've gone on and launched this poll. This is our poll asking you about what you have actually been able to learn and your experience here at this Project Echo. I'm hoping you all see this. Thank you. Thank you. So I'm going to give you a little bit of time to go in and complete that, and then we'll end our session. Have about 50% of folks. I think we'll just wait a little bit longer to see if we can get everyone in. All righty. Just a few more minutes and a few more people, and we will end the poll. We want to thank everyone for coming today. We hope that you actually were able to get some ideas about how to help your colleagues, your patients, yourself, your neighbors. And we hope you have a wonderful weekend. We've had our Optimal Aging Conference that Barbara Gordon led as our leader for on the planning committee. And we just want to thank everyone. If you had an opportunity to come, if you don't, there's always next year. And we thank you. Thank you, Dina, and thank you, Sam, for coming and giving those great presentations. Have a great weekend.